So this is something which is also a prior part of palliative care, which you all has to understand while dealing with palliative care patients. So it is interesting as well because this is something which is different from the clinical aspects like pain scale and all, but little bit related to humanity, care, concern, compassion and all. So it's something very much different. It's very much important, and one should understand and follow in palliative care setting. So I will go directly to the session. Hope you can see the visible. Yeah. So why is psychosocial important in palliative care? Does anyone have any idea about it? Is it something which we should consider? We should consider in a palliative care setting. Any comments? You can either unmute or put a comment in chat box. Anyone, any comment regarding the importance of psychosocial care in a palliative care setting? So do anyone consider this as important one? Yes or no? Is this important?
Then type your answers in the chat box. Type yes or no.
So is this a no or a yes? What do you imagine? Like, is it important to deal with psychosocial in a palliative care setting? You can put your answers in chat box.
Say good afternoon and everyone left.
Since we are dealing with the 3 p.m., I think everyone is sleepy. Everyone gone or are there? So is it a yes or no? Like, is it important to deal with palliative, like with psychosocial and palliative care? You can put a just an yes or no.
Yes, ma'am. Sometimes.
Sometimes it is yes. Okay. And what about others? One person has told it is sometimes a yes, like it's an important factor to deal with psychosocial aspects. Anyone has any other comments? So everyone is saying yes. So what makes you say an yes? Like, why do you think that is an important one? Prince, I didn't understand your answer. Can you please explain that? to extend patient's life. Okay, for extending patient's life, psychosocial factor may help us. Is that what you mean? So I'm going with Prince's opinion. Prince has said that to extend patient's life, psychosocial aspect may help him or her to extend his life in a last stage of his life. So does anyone have any other opinion? Okay. So yes, in some manner, it also helps a person in extending his life. It depends on what his problem is, like what psychosocial problem the person is facing. So yeah, I will give you in brief how it helps a person or how it helps a palliative patient in overcoming or in tackling or in improving the quality of life through the psychosocial support which he or she receives. So before that, uh, the definition by WHO regarding palliative care. I know you are very much familiar with this definition, but still I'm just reading it out. Palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. So, the red color words which we have highlighted says that palliative care is something which tries to improve the quality of life of patients. It's not only patients, but the families who are associated with the patients. How it is improving, like in which manner it is improving. It's improving in a way that through either through early identification and thereby assessing it and helping it in preventing and improving the quality of life. In what all aspects or in what all areas it is doing. It can be in the physical area, in the psychosocial area, and the spiritual area. So the last two words, the psychosocial and spiritual, are the main components which I'm going to focus here for today's session. So the physical aspects, maybe you might have already gone through that and you are very much have a good knowledge about it. Coming to the psychosocial and spiritual, how we are going to identify it, how it becomes a problem for a palliative patients, and how we can rule out and interview that person to which are interventions or the suggestions or solutions which can be given for a palliative care patients. So regarding all these things which will be handled on today's sessions. So this is a small research article which I have taken from Indian Journal of Palliative Care. So this is a research article by Arun Tanchal. She is from St. Luke's Hospital, Cape Town. So she has done a research study. Based on that, she quoted the sentence called the quality of life for patients and the manner of their diet is sometimes more influenced by psychosocial factors than by the physical status. So this is something which is connect to the comment which earlier Prince has given or put in chat box. So here what she is saying that sometimes dying can be much improved or much influenced more than by the physical than through the psychosocial. I mean, it can be more influenced by the psychosocial than by physical. The pain or the quality of dying can be much more influenced, and the quality of life of patients can be much more influenced and can be much defined by the psychosocial support which a person gets during their palliative treatment times. So This itself is an example or a research which tells us or explains how much important the psychosocial factor in a palliative care settings. Moving on, why is psychosocial care important in palliative? So before that, I will tell a small incident which I have experienced, which I have seen on my initial days of my work life in Pallium. So I met a person who is around 29-year-old in a palliative care setting. He is diagnosed with CA cervix and he came for the treatment, like supportive treatment to our hospital. His caregiver is his mother. His father has already passed away, and there is no other siblings for him. So mother is the one who is taking care of him. They both came to our settings, and later on, through the clinical assessment, he was telling that he is having around 10 out of 10 pain, and this pain can't be reduced by taking all the medications. So like we have given him, we were giving him so many different kind of medications, like how we can reduce his pain, but some other way it's all going into pain, like because he's not responding like reduce pain in any of the medications which we provide. So we again went to a like we were in clueless point, like what is happening with this person and why he is not getting reduced, why he is not getting his pain reduced. So there comes the role of the social worker and the psychologist. They came into frame. They had a very good communication, a very good rapport with him, and had a very good counseling session with him, and found out that the thoughts regarding his mother, like what will happen to his mother after his death. He's very well aware of the diagnosis and the prognosis what he is having. So during the night time or during the ideal time of him of his ideal time, he used to have tremendous thoughts regarding what will be happening to his mother after his death. Like who is going to taking care of his mother? Why at this age? Why at this younger age? God has done such a thing to me. So these kind of questions were coming into his mind, which makes him again more painful towards the life which he is facing on. He's not been able to have a good proper sleep and food. So thereby his pain also not being reduced. So this is what the reason which we found out the reason behind his pain. So yeah, this explains how the important is to find the reasons behind his pain. Like then only we can have a good treatment methods to provide him support for his future days. So through the intervention done by the psychologist and the social officer, we found out that he needs much of counseling and he needs his answer. Like he needs the answer for all the questions which he has. So we planned the treatment regarding that. Parallelly, we were giving him the clinical treatment also, which later on through so many sessions and through many counselings and through many therapies what we have done made him reduce the pain from 10 to 6. The which again goes on and the treatment is right now also is going on. So this is a small example which I have witnessed in my palliative care settings and which clearly explains the importance of palliative care, importance of psychosocial in a palliative care. So this is what is written in this slide, why it is important. So living with a life limiting or life threatening illness or the awareness of approaching death causes unique stresses and challenges. Of course, you all know, like if a person is coming to us and telling that you will pass away within few hours, what you will be feeling? Of course, you will get shocked. You will be in a very much clueless position. You don't know what to do. You don't know whom to meet, or you will be like, okay, I'm gonna die. You will be anxious about it, what is happening in me. So like that wise, even the palliative care patients will be very much stressed, and there will be so many challenges which they will face when they are on this life limiting or life threatening illness. So what we can do, like understand the factors related to a patient's quality of life is essential in providing appropriate care. So without knowing the reason, we can't provide a medicine, right? Only with correct specific symptoms only we can provide the medicines or the medication what he or she needs. Like that wise, we should explore the factors. Like we should explore what makes him gets worried, what makes him increase the pain, where or which area we should focus more to improve his quality of life. So we should be much aware of the factors related to his quality of life so that we can provide a very much proper, appropriate care for him. As palliative care is a life affirming approach, the psychologist similarly focuses not only on identifying and addressing distress and pathology, but also on enhancing well being. This includes validating individual and family strength, thereby promoting sources of meaning and purpose of supporting in the family system. So, after understanding the areas or the after understanding the causal factors, we can have a very much proper treatment method. It should be in a multi-dimensional way, like the clinical aspects should be there, the psychological aspects should be there, the social aspects should be there, the spiritual aspects should be there. All together, identifying or focusing on the problems and thereby addressing the distress what the family is having, and then later on enhancing him to the proper way. Okay, this is not being done for the patient alone, but to the family also connected to the patient. Then, psychosocial support helps in reducing the level of actual and perceived stress and in preventing the adverse psychological and social consequences amongst disaster affected community. So, on the examples which I have said before, so here, if we were not looking into the psychological aspects, he will be going into some other diagnosis like some kind of depression or sleep deprivation, something like that. So he will be going with the other aspects of diseases, psychological diseases, which again putting him as well as his family into a trouble situation. So rather than that, through proper diagnosis or through proper identification, we can be like as we said in the definition, through early identification, we can give him proper treatment, thereby enhancing him and putting and thereby preventing him from going into some other disaster. So, so because of all these reasons, we can say that psychosocial care is more important, especially in a setting called palliative care. I hope everyone is clear the importance of palliative care. You can either put a thumbs up on the chat box. Is everyone clear? Okay. So moving forward, here we are going to deal with the term called total pain. So basically, when someone comes and tells us that I'm having pain, what you will primarily focus on? Like, did you hit somewhere? Or did you have fallen anywhere? Are you having headache? Have you eaten your food? Is it because of that you're having pain or headache or anything? So we will mostly or most of us used to, majority of us used to think in a clinical aspect, like, okay, maybe he might have hit somewhere or fallen somewhere, or due to some kind of reasons like lack of sleep or lack of food, he may be having some kind of pain. Like due to some of the physical or biological reasons, he may be having some kind of pain. But here, when it comes, or here, what we explain is a pain is something which is not subjective only to the pain scale. It is a compounded one. When someone says pain, we should understand that that particular pain is associated with some other aspects, not only focused on the physical aspects. He is having some kind of physical distress, of course. Rather than that, there is some other compounds which connects to the physical pain. Thereby, it makes a total pain. So, yeah, when a patient reports his or her subjective pain on the pain scale, it is important to remember that the physical pain reported by a patient is compounded by his or her current life circumstances. And what are those circumstances? In which area we can put these circumstances? It can be either psychological, it can be either socioeconomic or spiritual. So just keep it in mind that when a patient says that he is having pain, it's not only subjected to the physical aspects, rather there are some other compounds which are associated to that pain, which makes that person distressed or in a situation or in a painful situation. Okay, so we are having a pain scale to assess the level of pain. But how we will assess a psychosocial pain? There should be some kind of tools or there should be some kind of assessments needed to identify the psychological, the psychosocial, economical, or spiritual pain. So based on that, we have came with an assessment called psychosocial assessment. And psychosocial is nothing but an evaluation of an individual's mental health and social well-being. So we will be assessing on the areas of psychological, that is the mental aspect or the mental health, and on the social well-being aspect. So with both these, by focusing on both these areas and by taking the assessment of both these areas, we will be getting an evaluation. So which explains the pain or which explains the problems or the concerns what that person is having on the other components, that is on the psychosocial spiritual components. Okay, so while taking this assessment of this mental health and social well-being, what are our aim or what is the aim of this assessment? So the aim of the assessment is to identify the area, what area, problematic area, which result from the illness and may influence the well-being of patients and the family. So, due to this illness or due to the reasons behind this illness, the person may be influenced with some of the other factors. And through the assessment, we are identifying those areas or those causal factors which puts him into a in a psychologically vulnerable or in a socially vulnerable level. And we focus not only on the patients, again we will be focusing on their families too. So this assessment involves, first one, we will be collecting all the information, and the second part we will be identifying and honoring the strengths, resources, and the needs what the patient wants. Okay, so what are the areas of assessment? So we have said like we need to have a proper psychosocial assessment, and during the assessments we will be focusing on the factors or the reasons behind the problematic and what are the factors or what are the areas of this factors. So these areas in general can be put into four bars or four graphs. That is the general one, the patient and family overview, insight, family structure, and or dynamics. So in general, what we are like, what all the information that we are collecting? We will be collecting the information of the patient and family, the insight regarding the patient and the family, which is also have put in the downer area, the family structure, the socioeconomic status, the environmental status, the psychological distress, spiritual impact of illness, interventions, and plan. So these are the points which comes under the general area. Coming to the patient and family overview, we will be taking the basic demographic details, occupation before and after illness, who is the primary caregiver and the relation with the patient, Insight is regarding the diagnosis is there, regarding the prognosis is there. Is the patient and the family aware about what is palliative care? Next, coming to the fourth part, which is the family structure and dynamics. There will be explained in genogram, like the family structure and the dynamics will be explained in genogram regarding what sort of family dynamics, whether it's a good dynamics or a strained one, who all the support system for the patient and their family, and is there any history of illness in their family. So these four are the general areas of assessment. Is this clear for everyone? Okay. So here we discussed about the basic areas of assessment. Again, we are moving on to the main prior areas. That is the areas which we have explained on the total pain. That is the psychological, the social, and the spiritual part. Here, what all concerns or what all information that we have to acquire. So physical part, yes, of course, you are very much uh, like we are having very much knowledge about this. It will be assessed based on the diagnosis what we have taken, and later on we will be assessing on the pain scale, like what number which he or she says on the level of pain that they are having. So based on that, we can interview the physical aspects of the patient. Coming to the psychological aspects, what we are looking here, or what information we need there. Of course, the mental health, like how much good or bad he is regarding the mental health. Is he weak or not? Or is there any kind of prior illness or any concerns regarding his mental health? Is he taking any medications too? That also should be assessed. His emotional well-being, how much emotionally strong he or she is. Is he a person who is very much weak in emotional wise? The emotional mature based on emotional maturity, he is having a very weak part, or is he a strong one? Any anticipatory grief is there inside him? How he cope up with the stresses which comes into him. So these all are the main important things which we should collect while taking the psychological informations. Okay, coming to the socio-economic aspects. Is he is getting adequate food, clothing, and shelter, which is the basic components which every human being needs, right? So, is he getting everything? Like, is he having the proper food, or is he getting proper clothing, or does he have a shelter to live in? So, basic details will be collected. And is there any breadwinner in family? Maybe in some cases, the main breadwinner will be the patient. So on that time, who is taking over the family? Is there anyone working, or there is no breadwinner, which should be identified? Any other source of income, like any other supportive systems, like families, I mean relatives, neighbors? Is there anyone who is helping them for the income related part? Does they have any debts? Any social support, which includes government schemes and other local financial support. Like, for example, here in Kerala, we have a pension called cancer pension for the cancer patients. So on that and all, we can assess like whether they are aware of such kind of pensions, and if they are getting any pensions like that. Also, we have another pension called caregiver pension. These all are connected with the local bodies. So is they are aware of this caregiver pension and all, and did they apply for it or not? So we will be collecting all those information. And education of the children, yes. Coming to the family, if there are children who are studying, are they going to school, or is there anyone who is taking care of the educational part, or they are getting support from other sources for the educational part of the children? So likewise, all these socio-economical informations will be gathered from them. Coming to the spiritual aspects. So here, connection, like connection in the sense, connection in the sense, is the patient is connected with himself or with the nature or with the family. Anyone can be. Connection doesn't mean that it's something which is related to only to the religious aspect. How much the patient is connected with himself? How much the patient is connected with the nature? How much the patient is connected with the family? So all these kind can be gathered. All these informations can be gathered. Strength and comfort. What is the person's strength? Where is his comfort area? So regarding the information related to those things, hope and concerns. Of course, we all will be having some sort of hope related to our personal life, our career life, our family life, etc. So, for that particular patient, what is his hope are? Is there any concerns which he or she has in his mind, which need to be collected, or those kind of information should be collected from him or her? The meaning and joy, how they find the meaning in life, what are the things which they find joyful in what all activities they find joyful, how they explain their joyfulness of their life, or is there any incidents or events which make them feel meaningful for themselves and which make them feel, yeah, happy and all. So these kind of areas should be collected, something which is related a bit internal to the patient. So all these information will be collected from either from the patient or from the family. So these are the four important areas where which we collect the main appropriate information either from the family or from the patient. So is there any queries related to this aspect regarding the assessment area? You can put yes or no or any queries in the chat box. Anybody please respond. Why you're not responding? Okay. So once again, I will just give a summary of the assessment areas. So what is assessment? Yes, it is an evaluation of individual's mental health part as well as the social well-being. And we will be focusing the causal factors or the factors which leads him or her to the to the stressful situations. For that, we need to collect the informations. So first part is collecting the informations either from the patient or from the caregiver. And the second part, we will be identifying which is the main causal factor or the problematic area. Then later on, honoring his strengths, resources, and the needs which should be done for him. So from which all areas we are collecting the information. So what are the causal factors which we need to be more focused on? So in general, we can say like we should be focusing on the patient and the family overview, whether the patient and the family is aware about the insight and the family structure and dynamics. So going more into the main areas or main components, yes, we'll be looking the psychological part, going to like assessing his mental health, or is there any illness or history of illness in in himself or in his family. Then understanding his socio-economic part and also his spiritual concerns. So this is the main area of assessment, and here we will be collecting all the information regarding to the mentioned areas. So we have came across one other aspect which is called the genogram. So this is something which is which where we used to take the pencils, pens, and all, and we will be having some kind of drawings and all. So this is something which this genogram was brought in by Murray Bowen, And what this is genogram? So this is a graphical representation of a person's family, and in that representation, we will be explaining the three generation of that particular person and his families. So there will be structure. We'll be explaining the dynamics. We'll be explaining the strength and the resources of the patient and family. In the xenogram, we will be explaining the information which includes the name, age, education or occupational profile, and their emotional relationship. So these are the symbols which we use in a genogram or in a family tree. So I will be explaining each symbol. The square one denotes a male, while the circle denotes a female. The square connected with a straight line explain that this male is married to a female. And when a line comes in between this line, we can say that they have got separated. And when it is a double line, we can say that the couple had got divorced. Okay, so the square one is the male, the circle one is a female. In between a straight line explains that they got married. And if a single bar comes comes above the straight line, we can say that they have separated. And this bar is a double one, we can say that they got divorced. So this is the basic symbols which we use or which can be visible in a genogram. Okay, this is how we explain the children again. Here, the circle in which a straight line and dotted lines are there. So this explains that the child is an adopted child. Okay, and here only dotted line is there with the symbol or the gender of the child, either maybe male or female. And this explains that it is a foster child. Coming here, it is a triangle one and with a straight line, which explains that the person is or the lady is pregnant or the like it's on the delivery, I mean on the pregnancy time. And here there is a closed line in between inside the square, which explains that stillbirth. The small symbol this here it's a circle, so it's a miscarriage. And crossed one explains it's an abortion. And from a particular point, two lines come with same gender explains that it's a twins and both are female gender. Okay, so once again, the male, female, married one, separated one, divorced one, and this is an adopted child. Only dotted lines are there, so it's a foster child. The triangle one shows, yeah, it's a pregnant time, stillbirth, it's a miscarriage, cross line which explains an abortion, and from a single point, two lines have been given where explains it can be either similar gender or both different one accordingly to the family which we can say. But if it is from a small dotted line, then it's a twins. Okay. So here we are explaining the genogram in based on the emotional strength. So this was general symbols which we used in a genogram, and this explains the emotional strength or the depth of the relationship in a family. So here the first one, it's a plain or the normal one, just two gender connected with the straight line. There is nothing kind of any denominations or any kind of lines are there. So this we can understand that it's a normal or the plain relationship. Second one, we can see that dotted lines are there. Here we can say that it's, yeah, there is a very good relationship, but not that much deep into. And it's not a normal relationship. So straight line with dotted lines explains that, yeah, a high five relationship. Yes. And the third one here, the darkened double line. So which explains that yes, they are very much close into it or they are having a very intimate relationship. Here, the red one, and it's a kind of a scribbled line. So which explains that some kind of hostility is there in their relationship. And coming to the last one, we can see that it's much more scribbled and much more darkened, which shows that there is a kind of a violent relationship in this family. So yes, scribbled one is a violent one. Double scribbled line with more darkened, it's a bit more violent. And this here denotes the arrow. The arrow in the sense, like here from the square to the circle, it's shown, the line is shown, and the arrow is put into the facing to the circle one, which explains that the male is having a high by relation or a close relation to the female. So the arrow explains from which direction to which is. Like the wave of flow will be explained based on the arrow which we denote. Okay. So this is a small genogram or family tree of a patient. So here, this will be explained by someone, I mean, from any one of you. So is there anyone who can come forward and explain the genogram? I'll be helping you. No issues in making mistakes and all. Anybody please unmute yourself and speak. Could you please explain this? Anybody? Sunita, are you there? Please respond something.
Hello.
Yes, yes.
Good afternoon, ma'am.
Good afternoon.
Ma'am, I think I would like some help. There is two families, I guess, in this
Yes.
two generation of first one, male and female. That Kumaran and Lala, they are diseased. I think this cross one.
Yes, yes, yes.
Shazi and Shindu has twin child, Amal and Vimal.
Yes.
And that I think this Shazi, Sidhu, and Raju. Raju is diseased one, है ना?
Yes, yes.
Sidhu and Raju has one child, Saran.
Yeah.
And the Sindhu is what divorced. Divorced.
Sindhu.
Sindhu.
Okay. Is she, what you were saying?
that Sindhu is divorced with Shaji, something like that. That I think that point is not clear.
Okay, no problem. I will explain. So anything
Mm-hmm.
else you want to add in this genogram?
Um, I think this this I could only understand, ma'am.
Okay, no problem.
Mm,
So
thank
I
you.
can give a small tip here. So
Mm,
whenever you are explaining a genogram, it's very much
mm,
easier if you start from the patient. So here we can say that Sindhu is the one who is marked with so many lines. So,
mm-hmm.
this is what this is how we mark the patient in a genogram. Okay, so here Sindhu is our patient, and that's why she is marked with several black lines. So whenever we explain the genogram, it will be easier if you start from the patient. So here, Sindhu, a patient, she is the daughter of Mohan and Leela. So Mohan had already got expired, and Leela, her mother is alive, and she is 60 years old. She is a homemaker. So first on the she got first married to Raju, who's a coolie, but he had also got expired. But in their relationship, they have a son, Sharan, who's studying in 11th standard. Later, Sindhu got again remarried to Shaji. He is the son of Kumaran and Laila. So both of them had also expired. And this Shaji is a mason. In their relationship, they're having twins, Amal and Bimal, both are 13 years old and studying in 8th standard. So this is the genogram of a patient called Sindhu and her family members. So this is how we can explain a genogram. I mean, by with the genogram, we can explain a family structure, the members in the family, their age, their occupation, and what sort of relationship will they be having. So anyone who want to try again, like after getting this hint, Sunda, you itself are going to give a second try.
Ma'am, it's clear. I think you have explained very nicely.
Okay.
And
So
so
it will
it's
be
clear now. Actually, the way I was not getting the Sindhu, that marked one, now what this mark stands for.
okay, fine. Okay. So you can again you can start with Sindhu because she is a patient, and it will be
Mhm.
easier if you start with the patient also.
Yes, yes, ma'am.
Okay. So this is the same genogram, but a little more deeper. Here we have given some emotional relationship also. So yeah, who can give a try on this? Same likewise, here also we can start from Sindhu. She's a patient. The same family members, but yes, there is some different uh, aspect is there, like the emotional aspect is also added into it. So who can give a try on this? So can anyone give a try in explaining the emotional relationship of Sindhu and her family? Sindhu has close relationship with her siblings. Okay. Uh, Kirti. Okay, Kirti. Okay, what you have explained is correct. Sindhu is having a close relationship with her siblings, Indu, Bindu, and one more is there. Yes, with her son, because we can see that it's a dark and green line in the figure, which explains that yes, they are having a very good, strong, good relationship. Okay. Anyone else? Because we can see that two red lines are there, scribbled one, and the wave is shown from Shaji to Sharat. So what sort of a relationship will be that, and who's having those relationship to whom? Anyone else? It's a conflict relationship with in-laws. Oh, whose in-laws? Can you please explain that? Can you please explain with the name, like who's having to whom, and what, like, is it a violent relationship or normal conflict relationship? Okay, brother-in-law of Sindhu's. Is Sindhu's having this conflict relationship to the brother-in-laws, or Shaji is having Sindhu's husband? Yes. So Shaji is having a conflict relationship with his brother Subhash and Veena, which is Subhash's wife, and Shaji is having a conflict relationship with Sindhu's first son, who is Sharat, studying in 11th standard. Because we can see that the wave and the arrow is from Shaji to Sharat. So, here a good relationship denotes Sindhu with her siblings and with Sharat, her first son. Here, Shaji is having a violent relationship to Subhash, Veena, and Sindhu's first son, that is Sharat. Also, we can see one dotted line here. Can you explain that? Also, regarding two lines from Shaji to his sons. Close relationship. Whose close relationship? Who to whom? Bimal to Sharat. Okay. So here, yes, a close relationship is there from Bimal to Sharat. And what about these two lines? Like from Shaji to Amal and Bimal? Friendship. Friendship, who's like, is it from Shaji to Amal and Bimal? Can you explain that friendship relationship? Okay, then I will explain. So yeah, Sindhu again, like Her parents, Mohan and Leela. Mohan had passed away. Leela is there, 60 years old, and she is having a normal plain relationship with Sindhu. They have three daughters actually. Like the elder one Indu and the younger one Bindu. Both are married. Indu is married to Mani and Bindu is married to Ravi. Sindhu is having a very good relationship to both her sisters. Then Sindhu got married to Raju, but he got passed away. And in their relationship, as we said earlier, they are having a son called Sharad. And Sindhu is too much attached to the son, Sharad. Later, Sindhu got married to Shaji, who is the son of Kumaran and Laila, both could passed away. Other than Shaji, he is having a brother. His name is Subhash. He is married to Veena. And yeah, this Subhash and Veena is having a strained relationship with Shaji. And in their relationship, like in between Sundus and Shaji relationship, they had two sons. Both of them are twins, Amal and Vimal. And Shaji is having a normal relationship, normal or plain relationship with Amal and Vimal, while this Shaji is having a strained relationship with Sharad. And wave is shown from from Shaji to Sharad. So this is the emotion, this is how we explain the emotional relationship in a family. And the circle, the last circle, like you can see that Shaji, Sindhu, Sharad, Vimal, Amal are enclosed in a circle, which explains that they all are living together. Okay, so this is the small genogram in which we explains the family structure, the family dynamics, the other elements like the age, occupation of the family members in a family, and who all are living together. So this is what we call the genograms. Any doubts or queries in this part, in the genogram part? Anyone? Or else then we can move forward. Okay. So, echo map. Here we were explaining the genogram, which is something explains about the person's family or the patient and his or her families. But while coming to echo map, this is something which explains this person's or this patient's family with the environment where he or she lives. So in genogram, we can say that it was a pictorial or graphical representation of the patient's family alone. But here we can see which are other components that is the social environmental components is involved with the patient and their family, and how the support system is going or any other family systems of relatives, neighbors who are supporting this patient and their family. So this is a family unit, and which all social parts will be there, which all social support system will be there, which we can see a patient can be getting support. The first is the health service. The second is the neighborhood system. The third is the workplace. Fourth is the government services. Fifth is community services, religious institutions, friends, clubs, school, volunteers. So again, there will be some other social support systems also, but a few of them is listed in this picture or in this diagram. Okay. So yes, as you can see, this is a small genogram of a patient and her family. And here are some of the social systems or the social supporting groups which the family is getting support. And the relationship with these also support system is explained. So yeah, is there anyone who can give a try in this? It is much simpler than the genogram. So here I can explain the family. This circle female is the patient, She is married and having two children. Elder one is a son, and younger one is a daughter. And this is the whole family. So here, like the arrows can be denoted especially to the special members. Also, in a group visit is explained. So while explaining, you should be keen like in which area the arrow denotes. Uh, yes, respectful relationship with neighbors. Is it from the patient to the neighbors or to the from the patient neighbors to the patient? Weak relationship with public health center. Okay. Is there a stressful relationship with members? Is from neighbors to patients? Yes. Okay. And what about the other arrows? So what sort of support is the family is getting from the church? Positive response from self-help group. Yes. So the arrow is pointing to the patient. So we can say that the patient is receiving positive response from the self-help groups. And can anyone say about the church, like the relationship of church with the family? Positive response from volunteer to patient. It's not particularly to the patient, but yes, we can say that's a family because the arrow was pointing to the family, the whole family. So the positive response from volunteer to the family. Yes. Okay. So can anyone say about this church? Like the darkened one and the arrows denoted to both sides. Positive response from school to child. Which child? Is the elder son or the younger daughter? Yes, good. The female child, that is the younger daughter. The school is having a very good support. Positive relationship from both sides, like church and patient. Yes, very good. We can say that to the whole family, not particularly to the patient, but to the whole family. The church is providing a very good relationship as well as like as vice versa to the family is too much dependent to the church also. Okay, so what about this panchayat member? What sort of a relationship is the panchayat member and the family has? Weak response. May I know from which side? Like, is it from the panchayat to the family or from the family to the panchayat? Yeah, weak response is correct. To the family. Good, good. And yes, what about the youth organization? Positive. Uh, can you please explain that? Like, in which direction it is? Both sides. Okay. Yes, they are having a very strong relationship from youth organization to the child, to the female child. The strong response is to the female side. Okay, yes. And what about the peer group? That is a friends group. What sort of relationship explains between friends and the patient family? Yeah, rather than saying positive, I can say that's a normal relationship. To both, yes, to the male and female child. And is it a vice versa relationship or it is only from friends to the children? Yeah, yes, both the side, yes. And what about the college? What sort of relationship is the college is? What sort of relationship is explained between college and the patient family? Positive both side, strong from both side. Okay. Is it to the family or particularly to the son? Okay. So try focusing more on the arrows. Like that is what which explains the energy flow. So yes, here there is a very good relationship between college and the elder son. Okay. So public health center. What about the public health sector? Weak to the patient. Okay, yes, yes. So the public sector is having a weak or a strained relationship to the patient. And yes, the last one, that is the colleagues. So what sort of a relationship is explained? Focus on the arrows. Positive from both sides. Yes, vice versa to the husband. Yeah. So it is a normal relationship from colleagues to the husband and vice versa. Okay. Thank you so much. I think most of them have responded. So this is how we can explain the relationship between patient and his family with the society or to the social groups. So I think everyone had understood this. So can I move forward? Okay, thank you. So yeah, so till now we were explaining about patient, how to assess the patient psychosocial aspects, what are the areas which comes under the assessment part, and how we explain the family and patient and her family, how they are connected with the society and all. So here we are coming or here we are explaining about the caregiver. So this is a simple sentence explained by Rosalind, where she says that there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. So, which explains that we all are also a caregiver. So, do respect them, do acknowledge them, and never dehumanize them by calling bystander. So, coming to the last part, that is the intervention part. So, through all these assessments and all the graphical representation and all, we have come to some sort of solutions. And based on that, we have to put which sort of solution should be provided to them. So here there are few interventions which we use to provide for the patient based on the psychosocial aspects. So first one is providing information, because most of them then will not be knowing about uh, the areas or the kind of solutions which they will be getting. Let it be any kind of psychological related one or the social related one. For example, I was telling you about the pensions what here our caregivers will be getting, and also especially coming to the cancer patients, they will be having some sort of pensions under the government areas. So most of them will not be knowing about it or will not be aware about it. So based on that time, we will be acting as a providing information for them regarding all those things. And then comes psychoeducation. Yes, we will be giving psychoeducation and awareness regarding the problem what the patient is having. And also, if it should be aware or given information to the family, then we will be giving them also supportive counseling sessions. Yes, providing proper counseling sessions and therapies based on that. Having regular follow-ups. Bereavement support is something where we doesn't put a full stop if the patient is expired, but after that also we will be having a continuous follow-ups. We'll be doing some phone call follow-ups. We'll be visiting the patient's homes, like to know whether they have gotten over that grief part and have come out of it and following their normal routines and all. Like that wise, we will be providing bereavement support, and which will be continuing like 6 months, 1 year, like that wise. And if we find that if there is the caregivers, the family have not gotten over from that grief part, then we will be focusing more on it. We will be providing them grief counseling and other therapies which is required regarding the situations. So, like that wise, we will be providing bereavement support, rehabilitations, facilitating like to the resources what they needed, and listen. So these are the interventions, some common few interventions which used to provide by getting or by going by taking the assessments or by through collecting the information which we needed based on the psychosocial aspects. So moving forward, this is a small case study. I will be explaining, reading through the case study, and later on, you will be explaining the each aspects. That is the physical aspects, the psychological aspects, the social economic aspects, and the spiritual aspects of the concern which the patient is undergoing. So, yeah, this is a case study of a 56-year-old lady, Mrs. A, who has been diagnosed with CA breast in 2016. She has undergone mastectomy and referred for pain management. She looked very anxious and had no idea about palliative care. There are other comorbidities like she is diabetic since 12 years, also coronary artery disease with a fracture on left leg due to a fall in 2019. She's a widow and her children are having a hostile relationship with her. Also, she is living alone in a rented house. So, this is the case study, and we can look how the areas, like each part of the areas, that is the physical, the psychological, the socio-economic, and the spiritual. So yeah, you can put the answers in the chat box. First, we will be checking the physical aspects. So may I please know what are the concerns related to the physical aspects of Mrs. A?
No.
Anyone? Like regarding the physical aspects, like the problems or the concerns which she is facing.
Please put it in the chat box. What are the physical problems that this patient is having? In assessment scale. She is asking about the physical problems. What are the physical problems?
Inability to move. Yeah, pain is there. Yes. Is there any other physical concern which she is facing? She's having few other comorbidities also. Self-image, okay. Yeah, body image issues, yes. But I think this can be put another psychological aspects. Okay. So yes, this is the physical aspects what she is having. She's having physical pain, fatigue, lack of sleep, of course, difficulty in walking, and body image issues. So regarding the psychological ones, again you have to focus on the psychological part, like what sort of concerns which she will be having based on her mental health. No concerns? Emotional distress, yes. Lack of sympathy. Good. Next. She is not aware of her palliative care. So, isn't she is confused? Ignorance, yes. Low self-esteem, yes, because she's having body image issues. Obviously, she will be having self-esteem issues. Okay, yes, we can check with the other answers. Yes, isolation is there. Emotionally weak, anxiety about future, unclear about her prognosis. Yes, because she was saying she doesn't know about the palliative care treatment and all, so she's not clear about the prognosis. Distress due to multiple illness. Of course, there may be a chance of getting depressed if the intervention part is not carried out. So these are the psychological aspects which we have seen in patient A. And what will be the socio-economic part? Because she's living in a rented house and there is no one to take care of her. So what can be the socio-economic problems? Yeah, financial problem is there. No caregiver. Good. Any other comments regarding children? Is there anything? No easy access to public health service easily. Okay. She's worried about medical bills. Yes, of course, because financial concern is there. She'll be worried about her treatment part also. She's living alone in a rented house. Yes, she's living alone in a rented house. So children and family support is not there. Yeah, she's independent and no one to take care of her. There is no caregiver. Obviously, she will be having concern related to that. Regarding children's education, loss of role of herself in a family and society. Okay, good, good. So a small, so yeah, from the answers you said, and we have collected and put some answers here. Strained relationship with family, unable to go for job, financial instability is there. Her house rent, because she was living independently in a rented house, okay, again, which will put her into stress, like regarding the house rent and all. Low accessibility to hospital, as someone said that she will be having no accessible to public health centers. So yes, that is a good answer. And absence of caregiver and support system. So last the spiritual aspects. So, what all spiritual concerns will be coming into her mind after going through all these kind of physical, psychological, and social distress? Loss of faith in God. Good, super. Then, what concern will be there? She feels stress. Of course, she is stressed. So, which leads to what concern regarding her spiritual aspects. Why me? Yes. Always blaming God. So, yeah, as you all said, she will be having extreme spiritual distress, which leads to questions like, why me? Why God has given so much distress to me? What I have done? Is there anything, any mistakes which I have done to someone or to myself? There is no person in life to depend on. I'm not getting enough joyful moments in my life because she's too young, and in that relationship itself, she's having a very hostile relationship with her children. So these all leads to loss of faith in God, loss of connection with family, no significant person in life, no memorable and joyful events in life. So through proper assessment and through proper observations, we will be putting all the concerns into these four aspects, and these four together contributes the total pain, which we will be assessing through the format which we had followed, and based on that we will be exploring it, what are the things which needed to be found out, and later on providing the proper interventions which will be again improving her quality of life. So this is a small case study in which we have identified all the four aspects of this particular patient. So any queries regarding to this? How to identifying the concerns of the patients in all the four aspects? Okay, thank you. So some tips to remember: evaluate our interventions. It may not be correct, so we need to recheck again and again whether our interventions are right or wrong. So evaluate our interventions. Assess how the patient and families are benefited. So is they are getting benefited to the intervention, like whether it is giving proper good solutions to the patient and the family. So we need to check that also, and these assessments have to be revised and updated, because like we will be giving an intervention for the particular focused problem or the factors which we have identified through the earlier assessment, and after that while rechecking the interventions we may be finding some other factor, causal factor, which again puts them into another kind of distress. So we should revise always while taking evaluation or the assessments, and based on that we need to update the interventions what we are doing. And yeah, there will be situations where we will not get immediate answers, so on that time be calm and reach out for the help when needed. And yes, there is an art and science in psychological care as like the medical care which we provide. So these are the few points which you have to keep it in mind by focusing on the psychosocial aspects in patient care. And that's it. Thank you, everyone.
Thank you, Neeraja, for the wonderful session. Anybody have any doubts? I hope this presentation is clear to everyone, because from the first day itself, we have learned about the importance of total pain. So if they have a physical, if they have a psychosocial issues, their physical distress will increase. So that assessment of psychosocial issues and spiritual issues are important. And always you have to give a special attention to that area also, so that we can able to improve the quality of life. Otherwise we won't be able to improve the quality of life of the patient and family fully, because if you focusing on the physical aspects only, you won't get the you won't be able to give a good quality of life. So always you have to give an attention to the other aspects, especially uh, emotional, social, and spiritual aspects. Okay, so that's very important. So today we have learned many things, especially how to assess patients, how what are the how important the psychosocial issues, and a patient with life limiting illness and life threatening illness, and uh, genogram. So that all is very important, because if you do it properly, from the documentation itself, your colleagues or your doctors can able to understand about the patient's family, if that issues and all. So family issues and relationship and all. So the assessment of psychosocial issues and the importance of total pain is very important, that we already learned. Today we have learned in the psychosocial importance of psychosocial issues. Thank you, Neeraja, for the wonderful session. Thank you for your participation.
Thank you, Neeraja, for the wonderful presentation. Thank you, Ma'am Shiva, ma'am, for the presentation. Thank you all for joining. Let's see you in the next session.